So now allow me to introduce Dr. Márta Fekete, a professional with a diverse academic background, holding degrees in communication and English language and literature. Dr. Fekete has been a valuable asset at the Ludovico University of Public Service since 2011. With a PhD in law enforcement science and penology, Dr. Fekete's expertise will illuminate our conference as she delves into the methodologies employed in the Growing of Competences project and discusses best practices for fostering competence growth among young inmates. So, warm welcome to Marta.
Thank you very much. So thank you for the introduction and the floor. I'm going to say a few words about, my topic is the impact of social skills development, and I'm going to say a few words about what we learned in Hungary throughout the 2 years concerning this topic. In the following 20-25 minutes, I'm going to say a few words about the basic importance of social skills in the reintegration process. And going to reflect a little bit on the possibilities of competence development in child protection from the point of view of scientific literature, basically, and what the results and long-term impact could be of competence-based learning and education in child protection and juvenile correctional settings. I will also reflect on the systemic or holistic approach, which means the togetherness of family professionals and NGOs in this matter. However, I'm not going to say too much about NGOs because my colleagues after me are going to present about the role of the NGOs in juvenile correctional settings. And then what I chose to introduce you to is the focus group, the results of the focus group interview, which has been the focus group interview has been done within the course of the project, and we asked several professionals about the prejudices and preconceptions and stereotypes that these have already been mentioned by my colleagues and presenters before me. So I'm going to say a few words about these, presenting you with a couple of narratives concerning the matter. First and foremost, it's been reflected upon previously in this conference that non-delinquents are more socially competent than delinquents and juveniles, and delinquents have less social knowledge. It's been around in the scientific literature for as long as 50, 30 years, and even, I think, longer. So our basic idea is that maladaptive behavior is due to lack of skills to do better, and it often comes roots in the family. And also these juveniles, these minors have the lack of inadequate learning. And I would like to refer back to Darius's presentation, and he said that dropping out of the school is very frequent among these juveniles. Also, they have very bad experiences and very many failures concerning school. So obviously, their perceptions about school has to be reframed as well. But the good news is that social learning deficits can be remedied by social skills training, but it has to be started at the very young age, and thus it can have a long-term effect and a greater impact on the juvenile's life. I would like to present you with. You can see that the research has been around for quite a long time. It's from 1988 from an Italian couple, where they evaluated 411 young delinquents. However, the same results can be seen in recent studies as well. And they found in this test, in this research evaluation, that although juveniles had the understanding of proper behavior and the social expectations towards them, they score poorly when tested in this matter. They score high when they are tested for manipulation, for physical and verbal aggression, oppositional behavior, antisocial tendencies, and a lack of the following rules, like Inga mentioned as well. And they score low with good judgment, morality, like acceptance of values, and it can be values of a family and values of the society as well. and the family functioning. So we can see that like as long as about 50 years, it's been around that that they, you know, the social skills and social competencies have to be addressed in a way within the juvenile correctional system or context or setting as well. Let me say a few words about the what works doctrine, which has been again around quite a long time, and it's connected to the name of Robert Martins, and obviously it has some sort of political reasons that the what works doctrine is here with us when he in criminal justice, when he asked what works, and he says that nothing works within correctional juvenile, not only juvenile correctional settings but also in the prison system. There's no a good practice or a good program that is proven to be working. That is, in short, the question of correctional quackery, which is, I think, a very interesting phenomenon in correctional setting. And a couple of Canadian scientists or researchers said that everything that is applied within the correctional setting has to be evidence-based. Like it just cannot be like some sort of program that we like teach to young children or young or juveniles, but it has to be, all the programs have to be evidence-based practices and measurable practices. McKenzie said in 2005 that the basic requirements of effective rehabilitation requires like trained professionals and institutional background, and I'm going to refer to the narratives that I am giving to you in this presentation, that trained professionals don't solely mean like psychologists, but somebody with a certain amount of humanity and pedagogue vein in them. It requires multiple methods, the researchers say, responsive to juveniles' individual characteristics. So it has to be like flexible and individualized, and also it has to be competence-based with cognitive elements. So like trying to change in a way the set of behavioral behavior in juveniles. Okay. Okay, something is wrong with me. I'm sorry. I'm not moving, right?
Oh, actually, I can see you moving. Everything works for me.
Yeah, but something is not. Yeah, thank you. Something has stopped. And I have a quotation from the American Psychological Association, the Commission on Violence and Youth from 1993, when they say the primary prevention programs of the type that promote social and cognitive skills seem to have the greatest impact on attitudes about violent behavior among children and youth. Skills that aid children in learning alternatives to violent behavior, like alternatives to violent behavior, include social perspective taking, alternative solution generation, self-esteem enhancement, peer negotiation skills, problem-solving skills training, and anger management. So if you want to reflect upon what works, these would be the answers to what works in this regard. However, I have also highlighted a couple of the methods that I have found in scientific literature, and also obviously in my everyday work when I'm dealing with this kind of field. Feedback and evaluation. Evaluation is has a very important role, referring back to the fact that these juveniles don't really have like good experience with school. So evaluation and good feedback is a must. Role plays, experiential education, field trip, and whatever, behavior rehearsal, social reinforcement, cooperative techniques, conflict resolution. One of my colleagues before me mentioned that as well, the debate, project works, and nonviolent methods. The good method has to be in small groups. These juveniles are often hesitant to participate in such group works. But whenever they realize that this is a trustful and good environment, they are more easily opening up. And it's also very important to have it with trained professionals, and it's not necessarily psychologists, but social workers, pedagogues, mental hygienic experts, and so on and so on and so forth. And the results can be, to referring back, self-esteem and self-reflection enhancement, acknowledgement of cultural, ethnical, sexual, religious identification, which is very, very important. And Inga has already also mentioned the importance of civil values in order to be identified with a certain set of values in a society that creates a sense of belonging and that creates some sort of value system in the juvenile. Perceptions of school has been mentioned several times, and anxiety reduction, which is also very important, a very important result for these children, for these juveniles. I refer that I will say a few words about the holistic approach or systemic approach, if you will. And it basically has like 3 legs, which I'm going to reflect upon: family, professionals, and NGOs. And NGOs is the topic of my colleagues after me, so I'm not going to say too much about that. But about family, it is very important that change starts within the community. So it's very important to deal with the family when we talk about reintegration process. However, desistance from crime is a result of a long multi-factor process, and that's why we are talking about basically like this holistic or systemic approach. Oftentimes, we can say, as an axiom with these juveniles, that families in itself dysfunctional, divorced, one-parent families, abuse, either physical, verbal abuse, or substance abuse are present. And the importance of strengthening families in their role to provide guidance and discipline as primary carers, like their role to provide values for the children. And it is very important to enhance that, to develop that, to improve that. From my perspective, it is the hardest part because, you know, within a closed context, you can like deal, you can learn, you can work with the juvenile, but then whenever they leave the correctional houses, usually they go back to their families, and the family is very, very hard to tackle on. There's another quotation that I'd like to share with you from Greenwood from 2008. When he says that the most successful programs are those that emphasize family interactions, probably because they focus on providing skill to the adults who are in the best position to supervise and train the child. So it's like the skill of the adult is another very important trait, or very, very important matter in this field. What about the professionals? I have already mentioned that the trained professionals and measurable results are must, like see the correction of Canadian researchers, Martin, Zamjandro, and the rest of the researchers. Sense of trust and acceptance is very, very important. And Inga said before me that sometimes these juveniles, these prisoners, I don't really like to call them prisoners, these juveniles don't trust the professionals that they are working with. So it's very, however, at the same time, these professionals are the only connection or the only link for them to like a normal background, a normal set of values. So it's very, very important to build on this trust. And also, it's very important to highlight that professionals work with their personality, either in conflict resolution, either in any kind of thing that they basically educate the children about. So it is the basic cornerstone of effectiveness. And I'm going to reflect upon it later when I'm talking about the narratives that we have from Hungary. I also would like to say an honorable mention on life-space crisis intervention, and one of my colleagues before me mentioned conflict resolution as well, which is basically goes beyond the context of correctional setting. because it's more about the job market, how to behave in a job interview, how to tackle anger, how to tackle defective behavior, and it's very, very important. This is another tool to work with when you work with juveniles, life space crisis intervention, or in short LSCI, which I like to highlight whenever we are talking about this topic. And then a few words about the NGOs, just, to provide some extracurricular programs, just to provide some excitement, just to provide something different. Also, I would like to say a few words about church. I mean, with the same, basically with the same role, like they have to provide extracurricular activities, and the role of schools, which I'm not going to highlight any further because I have already talked about it quite a lot of time. The sense of achievement, foundational values, child protection programs, and the positive experiences are very, very important within this context. And then I would like to say a few words about the results of the Hungarian research. It's a qualitative research, a focus group interview, and I chose to introduce this because I think we have received quite a lot of interesting narratives and quotations concerning the matter. Three areas being three main areas, but obviously a lot more than that have been reflected upon. Difficulties of working with the juvenile, with an offender, as opposed to with the non-offender. Difficulties in the work, in the community, and also reflecting on the stereotypes and prejudices that come when when we talk about delinquent behavior, and the reflections about the role of the family. So these are the three main topics, but obviously there are a lot more to talk about. I'm trying to be quick here. So what we found is that, and obviously almost all of the presentations in this conference have reflected upon it, that different people, these are different people with different background. And I'm referring back to the requirement of flexibility. Then as a professional, you always need to adapt to certain needs, and also you always have to understand, and you always have to understand when they come, where they come from, and you can work with what they bring to the table. This is a quote unquote. What's the difference between offenders and non-offenders? And as for part about prejudices and stereotypes, our professional says that there's not much difference, because those two are not in closed institutions, need the same input. We often think that we need to teach them differently, but after a while, the same topics will come up when you work with either like offender or non-offender. You have to obviously, as I have said, you have to obviously work with your personality and your basically personality, but you also have to be aware of the proportion, the rate, the highlight, and how you reflect and how you give feedback to these juveniles. But basically the main idea is the same. Like, you have to teach them, like, normal people, like non-offenders. As for competence-based learning, our professionals reflected on the importance of transversal competencies. So and it's also another thing that basically highlights the importance of holistic approach. Like, everything is connected, and if they learn a certain thing, they have to know that it's connected to another thing. So they have to think in context. One method is not enough, reflecting on the need of adaptation and flexibility. You need to have a plan, as like everybody who is teaching need to have a plan. And you have to accept your boundaries, and you have to accept that, with this certain group, this method would work, but with the other group, this method won't work. So you have to change it constantly and have to revise yourself. It requires higher degree of self-reflection as well, and you need to define success. And it's our professionals say that it's baby steps, basically. So you cannot crave a high something. It's baby steps. Prejudice. I have already reflected on upon the fact that this people, these juveniles, cannot be treated as offenders, or like they have to be like treated like ordinary people. You have to believe in the progress and the possibility of the progress, because if you don't, you can leave right away, which is very important. And obviously, another thing to underline the importance of accepting the baby steps. And you have to know that they are not inherently evil. They just, lack of social skills. They lack social skills. They don't have the important basic family background. Another very another prejudice in the community when we talk about like taking up a job. Stereotypes dissolve once they meet our pupils face to face. When you hear something that you are going to work with a juvenile or an ex-prison, ex-inmate, you will think that, okay, how am I supposed to do that? And it's it's only when you hear about them, but when you come face to face to them, it is beyond question that it is a possibility to work with these people, because these girls are sweet, quote unquote. One of the employers in Tesco, I think, reflected on girls who come from juvenile correctional setting. What about the competencies of the professional? Boundaries, I have said that already. They have to have the skill to deal with problematic minors. They can either be psychologists, social workers, pedagogues, and self-reflection is a must. And change and adapt to certain challenges and certain requirements when needed. Another thing is about family ties, which is several different and oppositional views have come up when we talk about, not have obviously have come up, but always comes up when we talk about family ties. Either you say that you have to keep the family ties, even if you write them letters and they don't reply 5 times, you make them to write the 6th time, because once they probably will answer the letter. But then because they have nothing, they cannot be let out in a vacuum. That's what our professional says. However, one of the other professionals reflected that sometimes it's better to be released in a vacuum rather than going back to a dysfunctional family. And one of the girls said, when we were talking to her about this issue, is that, I come back because I went home to my family, but I realized that nothing's changed apart from me. So there's no use going back to that family, which is quite a huge realization if you think about it. It was very important to realize that for girls it's very different. Girls are less important for their families. That's what we see. They receive less parcels, they receive less letters, they are not very important. Girls are being abandoned more easily. So this is another issue that should be addressed, I think. The final slide of my last but one slide of my presentation is conclusion and recommendations. To sum up just what I said, the importance of transversal competencies, like everything is connected, everything has to be put into context. The importance of systemic approach, the family, the professionals, the NGOs, the juveniles together, the church together. So we have to think and work towards a better goal together as one. Follow up if possible, like after release, which is very, very challenging, I think, because there's no human resource for that, no like material or financial support for that. But then it's very, very important because treatment is more successful in the community than in closed context. And I also would like to refer back to the correctional quackery part, that evidence-based practices should be used when we talk about juvenile correctional context and setting, or even not only juvenile correctional, but correctional settings. And here are the references that I used throughout my presentation, and I would like to thank you for your attention, and giving the floor to my colleagues who are going to say a few words about NGOs. Thank you.